Let's get back to the coronavirus and what's unfolding in Victoria. And I'm joined again from Canberra by Professor Peter Collignon. Thanks for joining us again, Peter. I've got to say, now that Daniel Andrews first up is locking down those suburbs of Melbourne again, yet not closing schools, he's proving that you were right for so many months, that school closures were unnecessary during this pandemic in this country.
Well, I guess we know a bit more than we did 2 or 3 months ago, but all the evidence internationally suggests children can get this, but they do it a lot less often than adults, probably 5 or 10-fold less often, and are not big factors in the spread. So, and closing schools obviously has huge costs, both for children, but, wider as well. So I think at the moment, all the evidence is that schools, it's still reasonable to keep them open because they're not a big factor in the spread compared to adults, and particularly adults not physical distancing, not doing appropriate infection control at hotels, etc., is the big factor in this.
Yeah, let's look at what's unfolded in Victoria. Obviously, there have been mistakes. You don't want a virus escaping from quarantine the way it has. But has there been an overreaction, do you believe, given the number of infections and the trajectory at the moment?
Well, I think the big worry about Victoria and Melbourne, these areas in particular, is the number of cases they're having. Now, while it looks less than what we had in March and April, the reality is back then only about 20 or 30% of cases were community spread. The vast majority were overseas residents or returned travellers. And now the numbers of community spread is actually bigger than then. So I think this is a concern. And I think the concern to some degree is, why has this happened? Is it winter? I think is maybe a factor in colder weather. But it's also, I think, after a while you get complacency. So the basic things all of us need to do for the next 18 months to 2 years, physical distancing, washing our hands, don't go with people who are sick. If we're sick, stay at home. I think those things broke down. And I think also when you're in a high-risk situation, such as a quarantine hotel, where maybe a few percent of the people there might end up getting COVID, that's where you need to be really vigorous about your infection control techniques and, make sure you've got face shields on, you've got masks, all those things when you're in contact with the people who are high risk. But more importantly, don't become complacent when you go home as well.
Yeah, I think that's a very important point to re-emphasise, just talking against my own argument here a little bit, and that is that what you're saying is those levels of, say, 65, 70 infections a day in Victoria are actually higher when it comes to community transmissions than what they had back in March, when there was they had higher numbers per day, but the majority of those were coming in from overseas. So that's something we should keep in mind. But on the other hand, yourself, Peter Doherty, the National Chief Medical Officers and their deputies have said all along that we ought to expect more infections and, moreover, more infections in winter. And the climate in Melbourne must make this more challenging, given what we know about viral behaviour.
Well, I think it does. I mean, when it's not clear why winter facilitates the spread of so many respiratory viruses such as influenza, parainfluenza, RSV, and this one. But presumably it's because it's cold outside, so we're inside more. The humidity is lower. We get closer together, and that facilitates spread. But whatever the reasons, and we don't know them all, what is beyond a fact is most respiratory viruses do spread more easily in winter. So we've got to be even more careful with the precautions. And this is spread predominantly by droplets, not by aerosols. And the good news about that is you're not going to get it just by walking into a room and breathing in because somebody was there, 10 minutes ago or an hour ago. Because it's droplets, there's lots of things we can do to decrease its spread. We can't make the risk zero, but we can really decrease the spread. And they're basically the messages, particularly coming up from the Commonwealth advertising. It's wash your hands, keep your physical distancing as much as possible, don't go anywhere if you're sick, stay away from others, even within your own home. That's important as well. If you're sick, try and keep your distance from others. But equally, when we have our friends and family over, no, we can't become hermits. But if you can do it during the day, that's safer at night. If you can do it outside, that's safer than inside. And as much as possible, keep your distance, and as much as possible, don't exchange saliva. So keep your kissing to yourself for a while. And if you have to do something, make it a quick hug and then try and keep your distance, particularly from adults. Children are a bit safer, but adults,
Stay off the kissing program. Just go the air kisses. Look, I think masks are coming back into the discussion because of that, and we can all wear those if people want to, because we know that our hospitals and nurses and surgeries do have adequate supplies of those. I just wanted to come back to the general question again, though, Peter. You make the point that Victoria's got to get on top of this, that there are a number of, high numbers of community transmission compared to what they've had previously. I still need to ask again, are they overreacting, given that we will need to live with this virus, as you keep telling us, for months, if not years?
Well, I think an overaction would be to lock down the whole state, because the people in Ballarat are no more of a risk than the people in Bundaberg, for instance.
Yep.
So if we do anything, we need to be localised. Now, how localised you get is an argument. And the other problem is, if we expect governments to solve all this, this is not going to fix the problem either. What we need to do is have a behaviour that's entrenched and persistent in all of us, including people in their 30s and 40s who, in some ways, or not a lot of ways, have a lot less risk from this infection, from dying or getting seriously ill. But they're probably the main way this virus is spread. And if you look at any outbreak, and this one I think is no different, it's people who've got symptoms, going to work, going to friends, going to family and spreading it.
Yep.
So we really need a better way of changing our behaviour and keeping our behaviour constant, and not expecting the government will fix this all for us, because that won't help if we're not all doing, or the vast majority of us, most of the time, are doing everything to decrease the risk.
Spot on, Peter. Thanks so much. Appreciate your clarity once more.
Thank you.